Alrighty, this is Laura Hall, and this is my second take of the assessment video. Alrighty, so knock knock. Hi there, how are you doing?
Good.
My name is Laura. I'm going to be your nurse today, okay?
Okay.
So I have an assessment I have to do on you, okay? It's basically where I look at different body parts and just check them out and see if they're normal. Is that okay with you?
Yep.
So I'm going to wash my hands, glove up, close the door for privacy, and then I'm going to get started. Alright, so the door is closed, and I washed my hands and gloved up, and my handy dandy paper here just to keep me on track. Alright, so can you tell me your name?
Joel.
Alright, Mr. Hall, now, what's your birthday?
12/13/1991.
Alrighty, and do you know who the president is?
Yep, Joe Biden.
Alright, great, and do you know where you are?
Yes, and at my room.
Alright, so this is the consciousness and orientation. Alrighty. So, and your speech seems appropriate, like you're answering my questions good. You look pretty clean. Do you shower? Do you use deodorant?
Of course.
Do you have any trouble with that?
No, I do it all by myself.
You're a big boy, huh?
Yes, I am.
Alright. So the first thing I'm going to do is inspect your head, okay? I'm going to look at your hair for any bumps, lesions, dandruff, parasites. So I do see some dandruff. Is that like been an ongoing issue?
No, it's normal.
You've had it for a while?
Yes.
Okay, not a recent thing. I don't see any bumps. I just see the dandruff. Your hair distribution looks good. Your hair feels good. It's not oily or anything, and I don't see any major bald spots. Now I'm going to test your face for sensation. So I am going to, that is cranial nerve 7 and cranial nerve 5. So do you feel this?
Make sure it's on camera.
Do you feel this? Alright, now do your jaw up and down. Alright, awesome. And now I'm going to inspect your eyes for any redness, discharge. Open your other one. Okay, I'm gonna shine a light dry real quick just to prepare your reaction. Look at me. Keep it open. Can you keep your eye open at all? Have you ever had any surgeries on your eye or anything like that?
Nope.
Glasses?
Glasses.
You've had glasses?
Yep.
How long have you had glasses for?
Forever.
Forever? Since you were like a kid?
Yes.
How come you're not wearing your glasses now?
Every day.
How come you're not wearing them now though?
Because I don't need to wear them. It's nighttime.
Are you supposed to wear glasses all the time?
Not when I'm going to sleep.
So you don't wear your glasses when nighttime when you're going to sleep, but other than that you wear them?
Yes.
Alright. Alright. So now I'm going to inspect your extraocular muscles. So that's what we're going to do. I'm going to have you follow my pen light, okay?
Make sure the camera can see it.
Alright. The 6 cardinal gazes. And that's good. You followed my pen light. And now I'm going to inspect your mouth and your nose. I don't get your nose. Your nose is bilateral, it's patent, and your pupils are pearl because they reacted a delight and they moved around and all the stuff they're supposed to do. I don't get your nose. I don't see any discharge. I see a couple stray boogers and some nose hairs, but everybody has those. And now I'm going to inspect your ears. Alright, do you have any problems with your ears at all?
No, I do not.
Any stuff with earwax, any drainage from your ears?
No.
Alright, ears look normal. Pulling on the pin, pushing on the tegus. Looking in the other ear. I see a wax clump in your left ear. A superficial one that you could probably get out with a Q-tip. But aside from that, everything looks normal with your ears, aside from the wax clump in your left ear. Alright, now we're going to do the hearing test, okay?
Okay.
So you're going to do a sound in your ear and you're going to tell me what you think it is.
It's a clicking sound.
Okay. Now I'm going to put my pen light by one of your eyes. You're going to use your peripheral vision and tell me what eye it's at, okay?
All right.
No. Guess
What are you
again.
talking about?
Look at, oh, so this is what we're going to do for this test. It's your peripheral vision. So I'm going to place an object in your peripheral vision of one of your eyes, and you're going to tell me if you see it and what you think it is, okay? You don't know your peripheral vision. So look straight. Look
Okay.
straight. No, look straight. Look.
I am looking straight.
Don't move your eyeballs. Do you see an object?
It's a pen.
What color is the pen?
Blue.
You looked at it. You're supposed to try it one more time. Do you have any problems with your eyes at all?
No.
You sure?
Mm-hmm.
Okay. What do you see the object?
It's a pen.
What color is it?
Blue.
Okay. There we go. Alrighty. And those were cranial nerves 2, and 3, 4, and 6. And now I'm going to look at your mouth. Open your mouth. Do you have any fillings or anything in your mouth? I see some spots in your molars.
Just dinner.
Your center. Well, I see some spots in your molars, Mr. Hall. Do you have any fillings or those cavities or?
They're cavities. They're cavities.
They're cavities.
But they're filled in.
Okay, so you do have fillings. Fillings in all 4 molars?
Yes.
Okay. Anything in your upper teeth? Your
No.
braces as a kid? Let me see. What, your upper teeth too? Go out. Go smile for me. Okay. Now go So you roll the rest of the phonation. Go out for me one more time. Go out for me one more. Oh, I see a little red spot on the back of your, like right at the top of your roof of your mouth and your uvula. A little like sore spot. That could just be something you. That's when you ate. And that is cranial nerves 10, 12, and 9. Now swallow for me. One more time. So your swallow is normal. Do you have any problems with chewing or swallowing your food or water?
Nope.
So no choking, no coughing when you're eating or drinking?
Nope.
Alrighty, amazeballs. Alright. And now we're going to check cranial nerve 11, which is you're going to turn your head against it. Okay, the other way. Alright, now we're going to shrug your shoulders. Alright, awesome. So do pass that test. And now we're going to palpate your lymph nodes. Okay, we're going to palpate your submental lymph nodes, which are under your chin. Then there's submandibular, which are under your jaw, right before the neck. Then your tonsillar, which is where the hinge of your jaw is. And then the paracircular, which is in front of your ear. And the post-orocircular, which is behind your ear. And then the occipital, which are in the back of your head. And then your supraclavicular, which is a collarbone. And then the post-circular, which is the back of your neck. And the anterior cervical, which is the front of your neck. Do you have any sort of pain when I palpated any of those
Nope.
areas? Alright, amazeballs. And I'm going to inspect the shape of your thorax. Can you take off your shirt for me, please? I have to do it on bare skin or lift it up. Either
You're
way.
gonna lift it up.
Okay. So, your thorax, lift up your arms for me. Looks normal. It looks 2 to 1. That means you don't have any pigeon chest or funnel chest, which is great. Your respiratory rate looks good. I'd say like 12 to 13 breaths a minute, which is fan-freaking-tastic. Alright, you aren't using any accessory muscles to breathe. And I'll do your shirt just to double check with that. Alright, not using any accessory muscles or abdomen muscles to breathe. Do you have any problems breathing at all?
Nope.
Alright, I'm gonna look at your spine. Can you bend forward for me? Can you turn that way actually? On the bed, gonna check your spine for alignment. No, there we go. Alright, your spine looks aligned, no scoliosis. You do have a lot of acne and pimples on your back. Has this always been an issue for you?
Yep.
And have you seen dermatology or primary care about this?
Yep.
And what have they said about it?
I'm young and beautiful.
You're young and beautiful. What else have they told you about it? Just like use over the cap.
Wash your back.
Wash your back. So no prescription acne products or Accutane.
Nope.
Alright. Okay. There we go. Now I'm going to palpate for sciatic turn that way. Alright. Now say 99.
99.
Say 99.
99.
Say 99.
99.
Alright, and that is to check out if there's any gunk in your lungs. There is no gunk, it sounds and feels the same all throughout. Now breathe for me. Breathe again. Now I'm palpating for thoracic expansion, and your thorax expanded beautifully. Do you have any tenderness at all in your back?
Nope. No.
Alrighty. Now I'm going to listen to your heart and your lungs, okay?
Okay.
So if you can sit here, and I do need you to either lift up or take off your shirt.
Okay.
Alright. So I'm going to listen in your heart. That's first. So I'm going to listen to the aorta, which is in the second intercostal space on the right hand side. And then the pulmonary, which is second intercostal space on the left side. Then Erb's point, which is like the third intercostal space in the midline. And the trigeminal, which is just below that, like the fifth intercostal space. And the mitral, which is just below the nipple area, like directly below in the sixth intercostal space. And then I don't hear any sort of bruits or murmurs or whooshes or gallops. Your heart sounds normal. Now I'm going to check your carotid artery for bruits. So I'm going to use a small part of my stethoscope. No bruits. And I'm going to feel for your carotid artery, okay?
Okay.
And you only feel for one at a time, because if you feel both of them, the blood flow to your brain is restricted and you could pass out. So you do have nice strong pulses there. Fan-freaking-tastic. They're both symmetrical. Alright, now I'm going to listen to your lungs as well, okay?
Okay.
I'm going to listen and look your front of your chest, the back of your chest, and axillary, which is under your armpits, okay?
Okay.
So, can you take off your shirt and lift it up for me? Thank you. Listen to all lobes of the lung. Needs to be a little more than that, honey. There you go. Thank you, sir. Alright, take a breath for me. Actually, we're going to start up here in the second intercostal space. Take a breath for me. And now the axillary. Alrighty, the front of your lungs and your auxiliary sounded symmetrical. Alright, now we're going to go this way. So no wheezing in your front, no crackles, and they both sounded the same. Now again. And again. And again. 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 And the final time. Alrighty. So now I'm going to listen to your bowel sounds, okay?
Okay.
So can you lie on the bed for me? Now we're going to get a good view of this. And I would not do this in a normal patient's room, but because we are short on space and short on camera view, I'm going to sit on the bed and lift up your shirt for me so you can see me listen to his bowel sounds. I want to listen to all 4 quadrants of the bowel. And And if we don't hear anything, then we're gonna listen for 30 seconds, like each quadrant. But if we hear something, we don't need to listen for the full 30 seconds because we know they're working. Alright, you ready, Mr. Hall?
Mm-hmm.
It's warm, okay? So lots of tummy girls, good bowel sounds, that's great. It sounds normal. I do notice some acne, like red bumps here. Do you shave your...
Yes, I do.
Okay. And do those typically go away, or have you ever got any ingrown hairs?
They go away.
Okay, amazing. Thank you, Mr. Hall. Alrighty. I'm also going to palpate as well your abdominal quadrants for any sort of tenderness. And your abdomen does look normal. It is not distended. Any tenderness or pain there?
No.
Alrighty, when was the last time you pooped or had we call it a bowel movement?
Today.
When today?
Like an hour ago.
Like an hour ago? And was it a normal poop? Was it
Normal
constipated? Poop. So smooth? Like
smooth
on snake? What about peeing? When was the last time you've peed?
Like 10 minutes ago.
And was it a clear pee?
It was a clear pee.
Do you have any problems going to the bathroom at all?
No problem.
Do you have any other problems with your penis or your testicles?
No, I do not.
And you get an erection like
Yes, I do.
Okay, have you ever had an erection that lasts longer than 4 hours?
No.
Okay, that is great. That is great. Now we're going to check the capillary refill of your fingers and toes and palpate the extremities for deformities, edema, temperature, and lesions. So can you lie down for me? Lie down really properly. There we go. Okay, put your head, be comfortable. Your fingers are kind of cold. Can I see your other hand? Your fingers are kind of cold too. Do your fingers like always get kind of cold?
Yes.
Okay, but they look to be normal color. So let me check your pulses. I'm going to check your pulses as well. So I check your radial pulse in the wrist, where they can see it. Those are good pulses. Your fingers are just cold. And then the brachialis. No, keep it by the wrist. And I would do that for both as well. But for this video, I'm only going to do one side. And now we're going to check your feet as well. So let me see. Your feet are kind of cold too. Do your feet get cold to your toes?
Yep.
Alright, I'm going to check pulses, your pedal pulses in your feet. Okay, those are good. Those are symmetrical. What about this red bump on your toe? How long have you had like that?
Forever.
Forever? Has it ever been an issue?
Nope.
Like, have you gone to see a doctor about it?
Yep.
And what have they said?
Just keep an eye on it.
Just keep an eye on it. So they said it's pretty harmless.
Yep.
Has it changed at all since you last went to the doctor about it?
Nope.
Alright, now I see this rough patch on your foot. Is it just looks like dry skin? How long have you had this on your left foot?
For a few weeks.
For a few weeks. Has it like caused any issues, or has this been pretty much
It's
the
just
same?
dry skin.
Just dry skin. That's what your doctor said?
Yeah.
Okay. Now I'm going to inspect the pulse behind your kneecap. And that pulse is the posterior, the popliteal pulse, which is right by the feet or dorsalis pedis. Oh, that was our leg too. It's good there. There's symmetry, they're bounding. And the posterior tibial pulse, which is on his knees. So I'm going to pull up. And then we're doing that. That's good. And also we're going to palpate the pulses in his brachial and radial pulses in his right arm too. We're going to do those because we need to do it for symmetry. So pop there. It's symmetrical, it's bounding. Symmetrical bounding. Symmetrical and bounding and symmetrical and bounding. So aside from the cold fingers and toes, which you've always had, you said your whole life, right?
Yep.
Okay, so no issues there. Woot. Woot. So what I'm just going to do to keep track. Alright. Now, this is what we're going to do. Can you push your foot towards the ceiling? Can you push your other one towards the ceiling? Now move it out. Now move it in. Sorry, my computer went to sleep. Alrighty. Now we're going to flex your foot against resistance. Okay? Now extend it. Now do it up. No, do your foot. Flex and extend your foot. Flex your foot up. There we go. Now extend your foot. Now flex your foot and extend it. Alrighty. Now we're going to do the grip test, okay? You have my hand, now grip it. Damn, you have a strong grip. Alrighty, there again. Alrighty, good, good. Now can you move your arms up toward me, towards the ceiling? And move them to the side. And move them down. And shake them all about. Do the hokey pokey and I'll shake it around. Now we're going to stand up for me. Now we're going to do the Romberg test, okay?
Okay.
And this is where you're going to stand feet together. And your feet are
together.
Together, you can't really see that because of the. I'm gonna move this. Your feet are together, and then you are going to stand with your arms flat, and I'm going to see if you sway. All right, no swaying. You're good. You passed the Romberg test, and now test like you're getting your balance. Now you can sit back down for me. Do you have any problems walking at all? Have you ever tripped or fallen?
Nope.
Nope. Okay. Do you use any assistive device like a walker at home?
Nope.
Alrighty. I want to touch your neck real quick. Turn your neck the other way. Turn your neck the other way. Whoop, whoop. So we did that. So just going to go over everything here to be sure I got it. Woo. So I think we have covered everything in this. Anything you want me to know about you health-wise that I haven't already discussed?
That's all.
That is it. Alrighty, Mr. Miz. I'm going to put you back in bed, okay? So you're going to lie back down for me. Alright, and you have your blanket. Do you have to go to the bathroom at all?
No, I do not.
Are you positively sure you don't have to go to the bathroom?
No, I do not.
Alright, so I'm handing you your call light and your bed alarm's on so you don't fall and bust your face. And now I'm going to deglove, wash my hands, open up the door. Alright, Mr. Mims, I'm going to do some charting. You have your call light and your bed alarm's on. If you need me, don't hesitate to give me a call. And that is the end of the assessment.